Good evening, everyone. My name is Christopher Michaud. I am the Director of Public Health for the town of Dartmouth, and I want to thank everyone for coming tonight. I know how hard it is for people to they live very busy lives, and to pull away from that is extremely difficult in today's world. So, thank you for coming, and we need your assistance in working on this. So what I'd like to do is just give you a little bit of a brief background on tonight. I promise not to be too long, and to turn it over to the speakers who are here to deliver a much more important message. I've been with the town of Dartmouth since 1995, and up until 2004, halfway through 2014, substance use had never crossed or been my desk or the office. And in 2014, there were discussions. Following that, we were approached by a neighboring community, New Bedford, to start to work collaboratively with other communities. We signed on to a grant application, and we were working with New Bedford, Wareham, Mattapoisett, Marion, and Rochester to address this issue, substance use. In the fall of this year, I found a surge of interest in dealing with this. With the new youth advocate, Jen Cabral, with the new superintendent of schools, Dr. Bonnie Gifford, and with the new chief, Robert Zahler. That has made it possible for us as a town and a community, more importantly, to come together and to work on this issue. There's no one person or one department that can address this. The town itself can't address this, and even our meeting group, COPE, which we have recently formed. COPE is an acronym for Community Offering Prevention and Education. This organization is a collaboration of public and private interest. One of our first steps is to offer this presentation tonight. This allows us to let you, the public, know what we're working on, and to assess the community, to find out what your unique interests and concerns are. We see a lot going on in other communities, more urban communities, and they may be well ahead of us, and we can learn from them. But also we realize that maybe what works in Taunton, Revere, or Gloucester needs to be tweaked here in Dartmouth. So we've recently formed COPE, and there are a number of private interests there. We're going to bring in more people as well. And you'll be hearing more from us in the future. You'll see more social media and web page. I guess the only thing that concerned me leading up to tonight is that there'd be very little interest in this meeting. Some of you may know me through last week's media sensation over the bobcat found in Dartmouth. And at that time, I remember thinking to myself, I hope that this doesn't diminish next week's event, because this is far more important. A bobcat is just a small animal, a little bit larger than our house cats that we all enjoy, or most of us enjoy, that pose no risk to us when you weigh it against substance use. We know in Massachusetts that overdose deaths have now surpassed vehicular fatalities, and that data for overdose deaths is not entirely true, because there are another number of other deaths where there is an underlying, where opiate use or substance use is the underlying cause. So thank you for coming here tonight and erasing my concern about the public's interest in this matter. And with that, I'll turn it over to Taylor Cormier from WBSM.
Thank you, Chris. Good evening, everyone. I suppose I was asked to come here tonight because I'm a public speaker of sorts, and we talk about this issue nearly every day on my program, 12 to 3 on weekdays on WBSM. But as somebody who's been thrust into this myself in trying to learn much more about this issue, I find myself doing a lot of the research, talking to a lot of the folks we've had here on the panels, and throughout New Bedford and throughout the community, we are all trying to educate ourselves on how to educate others. We're dealing with an element that has brought frustration anger, sorrow, pain, disguising itself as relief, peace, tranquility, and euphoria. And it's tough to get out of that mindset for many people. Feel free not to answer this question, but how many of you have been affected by what we're talking about here tonight, by show of hands? That's astounding. And I'm sure if this auditorium were filled to capacity, we'd be even more blown away by how heavily this has impacted our area and throughout the nation. How many are here because they're concerned about a loved one, a child, sibling, parent, friend? And I'm sure the age ranges are just as variant. Tonight we bring together town leaders, law enforcement, health experts, medical personnel, and others to begin a discussion that seeks to find a solution. Keep in mind the solution is no longer just in the hands of these seated on stage, but it's in your hands as well. Just a few notes. At the rear of the auditorium, just before you enter, there's a table with blank index cards. We're going to have a question and answer session after all the presenters have spoken. If you'd like to fill one of those out and anonymously submit a question, you can do so. There are also surveys that can be filled out anonymously after this presentation. Thank you all for coming once again. So with that, by the way, any members of the press, first of all, thank you for coming and for covering this important issue. We just ask that you refrain from taking any pictures of the audience. Feel free to take as many pictures of us, I think, as you'd like. But for the safety and security of those in the audience, please refrain from doing so. Our first panelist tonight is Dr. Bonnie Gifford. She is the superintendent of Dartmouth Schools. Bonnie, thank you so much. Oh, we do have a speaker. I'm sorry. First to give us her story is Callie Nunez. Callie.
Hi, everyone. So like they said, my name's Callie Nunez. I'm a junior nursing student at UMass Dartmouth, and I'm here to share how addiction has affected my life. So my brother's been an addict for as long as I can remember. It's affected every member of my family, not just me, not just him. I have two brothers. My oldest brother and my brother, who's 6 years older than me, they were best friends. But once my brother started using drugs, they totally acted like they didn't even know each other. My mother and my father ended up getting a divorce, and my father blamed the whole thing and the whole addiction on my mother. I was really young. They're 6 and 8 years older than me. But once I ended up seeing what addiction was and how it affected somebody, I never thought that my brother was capable of becoming that person. He was only 13 when he picked up his first drink. After drinking, he started smoking weed constantly. It ended up becoming so bad that he had to take perks every single day just to get out of bed. Despite all of those challenges and his addiction, he ended up getting a full scholarship to Worcester State for basketball. He only ended up attending one semester. He came back home and the same thing was going on. He was using perks every single day, barely getting out of bed. One day, I was at a party and someone asked me if my brother could bring him drugs. I was totally in denial. I said that that wasn't even my brother, that he didn't do anything like that there was no way that he was capable of bringing anybody drugs because he didn't even do them, even though deep down inside I knew he did. I went home after that, and I just remember sitting in my room crying and thinking, like, I should tell on him, I should tell my mom, we can get him help. But I didn't want my brother to be mad at me, so I didn't. I kept my mouth shut. 2 weeks later, my mom found pills in my brother's room and confronted him, and he agreed to go to rehab at just 21 years old. We thought that it was going to be the first and last rehab that he would go to, but unfortunately it took a year and a half for him to get clean and stay clean. We even had to send him out of state to Arizona to a rehab to get away from everything. On February 23rd, 2016, my brother had 4 years of sobriety. He goes to Bridger out of state to be a math teacher. He holds a job. He's buying his first house. he has a stable relationship, and he's the basketball coach at Whitman Hanson High School. So the big message here is just never give up, because there is hope. Thank you.
Very important message. It is possible. As I mentioned, our first panelist from the stage to speak tonight is Dr. Bonnie Gifford, the superintendent of Dartmouth Schools. Ms. Gifford?
Yes, thank you. I guess that's on. So I'm here to try to represent the educators that are involved in this crisis to the best of my ability. And there are others in the audience that can certainly address it better than I can as they work with our students every day. But first, what I want to talk to you about for a second is when I was down at the Cape for the last 5 years, and all of you have heard the Cape's issues, and the crisis is pretty profound. And I was the superintendent in the Falmouth Public School District, where this epidemic was so evident. It affected our students, it affected our families, and we worked very closely with our police department there to implement or facilitate this kind of panel discussion to start the discussion. We had experiences where we had little children in elementary school wake up one morning and mom didn't wake up. And what does a school do in that moment? And it turns into all hands on deck to try to support the family as well as obviously our children. So coming from the Cape, I had that background of what was going on in our schools and how could we address and help our students. So here, when I started here, one of our big focus areas for our school district is our social emotional learning, because we're trying to address the mental health of our students to the best of our ability, because as we know, the drug abuse or the other kind of substance abuse is only a symptom of other issues that are happening. Whatever the disease is, whatever the mental health issue is, this is what people do to try to escape the issues. So with that in mind, some of the things we've been doing is started up this Healthy Dartmouth Committee, which then evolved into this, because again, our focus area is going to be working on the social and emotional health of our students. With that said, obviously we have our partnerships with our community organizations, but some of the things that we're doing in our schools is we need to continue to provide our counseling, our adjustment counselors, etc. We have curriculum in our health and phys ed department, but it's never enough. But it's how do we get to the root of these things that our students are being affected by, and how do we offer the support in our schools? Because as we know, it's not always just our students, but it's their family members, as we just said, and that affects our children. So one of the things we did the other night as part of our community series was show a movie called Race to Nowhere, and we're going to continue using that because it was a very poignant film that addressed the stress and anxiety that our students are facing. And a number of the young people in that film talked about the number of painkillers or uppers or downers or whatever you want to call them they have been taking to deal with the stress and anxiety and sleep and the not sleep, etc., which obviously it's happening. It's happening out there. So we've come together, as I said, in this forum to try to address this with all of our community partners. And I just wanted to read one thing. It's from 2016 Facts and Figures from American Society of Addiction Medicine on adolescents 12 to 17-year-old. And this was from 2014. 467,000 adolescents were current non-medical users of pain relievers, with 168,000 having an addiction to prescription pain relievers. So that's our other message, to be really careful about that. So I'll leave it there right now and to move on to our next guest.
If I could ask a question first, at what age, at what grade level do we begin to address this issue and bring it to the students' awareness?
What age do we? Probably more the middle school level, but I think it's the stress, anxiety, and again, even that movie the other night, Race to Nowhere, and the information we're getting, the stress, anxiety, it's getting younger and younger for our elementary kids as well, and we see kids that young on some kind of antidepressants.
Oh, thank you.
Yep.
Next speaker is Chief of Police at UMass Dartmouth, Emil Fioravanti, also the Director of Public Safety. Thank you for coming.
Thank you, and thank you for the opportunity to speak tonight. I'd like to welcome everyone here. And this is a very, very important topic. Certainly one that touches people, not only the people who have the addiction, it's the families, it's the friends, it's everyone that comes into contact with a person who's struggling with this problem, with this illness. My own personal history, I've been a police officer for, I hate to say it, over 40 years. And I've seen a complete metamorphosis of opiate addiction, the profile of what you would expect to see in a quote-unquote person with an opiate problem. But when you look back, opium and opium addiction has been a problem in this country for well over 100 years when it was actually legal. The product that was out when I first started was probably about 20 to 25% pure. The adulterant or the additional chemical that was, or substance that was added to bulk up the product would make up the remaining 100%. That model in 40 years has flipped. The potency of street drugs, what they've been adulterated with, again, this is not something you're buying from a pharmaceutical house. This is not something that a toxicologist could tell you or predict the lethality of it, what the lethal dose may be. However, it's completely buyer beware. People don't know what they're getting. And with the problems that are associated with this, they're completely compounded with almost a cavalier attitude that, you know, heroin and opiates, the fact, especially with prescription drugs that are opiate-based or of that particular molecule, that, you know, they're innocuous. They're not something that's going to hurt you, but nothing could be, you know, more distant or far from the truth, as everybody in this room actually knows. So how did we get to Narcan? How do we get to getting a quick response for people who are struggling with this that we're going to encounter from a law enforcement perspective? Well, you know, Narcan has been around for a while, but I think, at least in New England, what we've seen, is almost an unstoppable process or onslaught of people who have easy access to the drug, are overdosing, and are dying. So in an effort to try and stem and you know, stop the tide of you know, this insidious disease, we've at least mobilized something that our law enforcement and medical responders can use, Narcan. At the university, we started about 2 years ago, in 2014. We had our officers trained. We deployed it. It's carried in every medical kit that we put out there with police officers every night. We've used it. You know, when we first started talking about this, people questioned my sanity and said, you know, why? This is a university. You know, we won't have a heroin or an opiate problem here. And, you know, again, I wasn't out to set people straight and say, you know what, I'm right and you're wrong, but it was only a matter of time. You know, thankfully we've had some saves, but more importantly, I think it's the approach at the university, and especially my two colleagues are out in the audience. Beth Ann Guthrie, where are you, Beth Ann? And Sheila Dorgan. They've done a great job with the three major approaches that we've taken on this, really, for our students in our community. We've got roughly, any given day, about 10,000 people on our campus. We are a town within a town. And to think that we're not going to experience the same things that what is around us, and in particular in that 18 to 24 age bracket, we'd be deluding ourselves. So consequently, what we've done is we've embarked in a great, I think, a great approach with our peer educators, getting the word out, telling students that, okay, look, we realize that some people may have a problem. The approach that we've taken in public safety, if you have a problem, if you're using, we'll help you. But if you're selling, we're going to arrest you, and we're going to hunt you down. Plain and simple. I think, once again, I don't want to step on anyone else's presentation. I think just once again, the messages, we just need to make it clear that this is not about arrest. It's really about education. We cannot arrest our way out of this problem. And I'm hoping that with the help of a lot of people that we can make a significant impact upon this. So thank you.
Chief Fioravanti, I wonder how the campus public safety officers are disseminating information to the students and to the faculty members. What is being given to them to make them aware that there is an element on campus and that they should be aware?
I think it's not just on campus, and it's not just at UMass Dartmouth. I mean, if you do a quick search in the internet and just Google opiate addiction or opiate problems or overdose on college campus, you're going to find some pretty high-end schools that have had this problem, that were actually acting on this back in 2014, 2013 as well. Not just Ivy Leagues, but some big-name schools. This is a problem, once again, it's not delimited to our region. This is a national problem. It really is. And it's really we're probably more aware of it only because of where we're situated. The truth be told, there's been a historical problem with opiate and heroin addiction with fishing communities, starting from Rhode Island all the way up to the Cape. And this didn't start 10 years ago. This started literally decades and decades and decades ago. And I think people were aware of this, and I think at least the social awareness, social consciousness is much higher or much greater in our area. So I'm hoping I answered your question.
Good enough. Yes, you did. Thank you. Next speaker tonight is Jennifer Pope, MD. She's the chair of St. Luke's Emergency Medicine Department.
Thank you. Thank you. My name is Jen Pope. I'm an emergency physician as well as a chair at St. Luke's. I've had the privilege of being able to care for patients in this community for the last 3 years. And as many of you know, St. Luke's is the top 3 busiest community emergency department in the state. I'd like to talk a little bit today about what we experience in the emergency department as providers, what our responsibility is as physicians, as providers, and how we'd like parents and loved ones, how we think they can help support us and people who suffer from addiction. So I'll just tell you about my shift yesterday. I worked an 8-hour shift seeing numerous patients. My first patient was an 18-year-old male who had gotten to a very low-speed accident on his motorcycle. He was riding, he fell off at low speed, he had a helmet on, and he came in complaining of right wrist pain, and he came in with his family. He wore his helmet, he did not hit his head, he did not lose consciousness, and after a full history and physical and imaging, we found that his only injury was a very minor fracture of his wrist. He had minimal pain. I gave him Motrin or ibuprofen and acetaminophen to help with that pain. I put him in a splint and arranged for orthopedic follow-up. And as I did his discharge, his parents came over to me frantically and said, "Aren't you going to give him something stronger?" A few patients later, I picked up a patient whose chief complaint was suicidal thoughts. And I walked up to a young man on a stretcher, covered in a blanket, who was shaking and sweating and dry heaving into a bucket. And I approached him and asked him what was going on. And he said that he had thoughts of wanting to kill himself the past few days. And when I asked him more, I found out that he was actually addicted to OxyContin, had moved on to snorting heroin, and had run out of money to buy any medication for the past 2 days, so was withdrawing. And in that setting, he wanted to kill himself. A few patients later, I was asked to see a young woman with a rash. I went to see her. I noticed her vital signs. She had a fever of 103, which is also a very high heart rate. And I went to see her, and her whole entire right arm was swollen. It had started in her hand and tracked up her arm. It was red, hot, swollen, and painful. And clearly, by talking to her, the infection had started to spread likely to her bloodstream, causing what we call sepsis, or a severe infection. When I asked her if she had banged her hand or had been bitten, she said no. I then asked her if she injected into her hand, and she said yes, and the needle had broken off. And so at this point, she needed to be admitted to the hospital for aggressive IV antibiotics, fluids, and was at risk of potentially losing her arm because of this infection. Probably about 3 hours later, I was called emergently to the trauma room. My nurses were running down the hall bagging a patient, a young man who was blue. And because our nurses are so accustomed to this and very well trained, they were actually administering intranasal Narcan, or the opioid reversal medication. So by the time he actually hit our trauma room, he was gasping and breathing and yelling. He admitted to accidentally overdose. He was not trying to hurt himself. He said he uses heroin on a regular basis. I then talked about the risks of this, and asked him to stay so we can monitor him, because the Narcan will wear off after about 90 minutes and they are at risk of becoming unresponsive again. He then swore at me and told me he was not staying, and we begged him to stay. Family did arrive and ask us to help and intervene. Unfortunately, when they are adults, there's nothing more I can do. I did offer a prescription for Narcan. I told him the risks of leaving, but he did leave. And then the last patient I want to tell you about tonight was a 75-year-old, my last patient of the night, 75-year-old man who came in short of breath. I went to see him, very lovely, kind gentleman who presented with some shortness of breath for 2 days. I proceeded to take a full history to find out the cause of his shortness of breath. And at the end, I asked him 3 questions that I ask every patient. I said, do you smoke? He said, no, I quit 5 years ago, and I commended him on that. I said, do you drink alcohol? He said, no, I never have drank alcohol. I said, do you use heroin or opiates? He said, yes, I last injected 3 days ago. These are the kind of cases that we see majority of the day. Although last year at St. Luke's, we saw 460 opiate-related overdoses, and that's just by billing and coding, so we know there were significantly more. Most of the patients were ages 18 to 45. The reality is this is a disease of the very young and the very old and everyone in between. As providers, what is our responsibility? Our responsibility is to see and assess every patient that comes for help. When people are in pain, our job is to treat their pain, and obviously our first line go-to is non-narcotic options, but sometimes patients do need stronger medication for acute pain syndromes. It is then our obligation to talk to patients about the risks of opiates, the risk of addiction, and the other side effects that comes with opiates, constipation, drowsiness, many other things. We have very clear guidelines on prescribing practices for emergency physicians around opiates. We are not allowed to prescribe more than 5 days worth of opiate pain medication. Most of us stick to the 3-day rule. We are also not allowed to refill lost or stolen medications, and we are not allowed to refill medications used for chronic pain that someone gets on a regular basis. We try to be as clear as possible about these guidelines, although sometimes people find that we're not treating their pain. So we know it's a problem. We know it's our responsibility as providers to give people education and information about this. And I'd like to just briefly talk about the adolescent patient population, because I think that's an important piece. Although we do not see them, we know it is happening, and these are our 21-year-olds that we're seeing who overdose. So we know 1 in 6 kids will have used a prescription medication that was not theirs. As we probably all remember in this room, adolescence, middle school is a tough time. It is stressful, it is depressing, there is anxiety, there is bullying, and there is peer pressure. And so we know that the developing brain, the first part of the brain that develops is their area for excitement. And the part of the brain involved in understanding risks and consequence develops after that. So kids are going to make bad choices. It is our responsibility as parents, loved ones, family, friends, aunt, uncles, grandparents to store your medication appropriately. Keep it locked. Do not leave it in the kitchen drawer. Do not leave it in your bathroom. Do not leave it on your bedside table. These should be stored and disposed of appropriately when you are done with them, because this is where kids are going to first get them. The other part of that's important is medications used for ADHD in kids can also be abused. And so as a parent or a loved one, please monitor those prescriptions. And the other most important thing is talk to your kid. How many parents out there have already talked to their kids about sex education? Probably most of us, right? If you haven't talked about opiates, I can tell you it's far more dangerous than sex. As parents and loved ones, please, as angry and distrustful and frustrated and scared as you are, please try to keep an open mind about this. It is an addiction, and the more you foster that relationship with your child or a loved one, the more they are willing to turn to you when they are under stress or duress rather than turn to drugs. And if you can't do that, there are always school counselors, nurses, community resources, and the emergency department who can try to help you with that. So, thank you.
I do wonder, there's legislation that's working on being passed right now that would limit the prescriptions of painkillers to just a 7-day supply. How would that affect what you do?
It's actually what we already do. So that hasn't changed for emergency providers. What is being recommended right now is a mandatory assessment for everyone who comes in with an overdose. That's a double-edged sword, right? So anyone who comes in with an intentional overdose obviously is not allowed to leave the hospital, has a psychiatric assessment, and often is hospitalized. Most of these overdoses that we are seeing are recreational, and these patients are not ready for help. They don't want help, and we cannot keep them there. By law, they are competent to make decisions. We cannot hold someone against their will unless we think they are an immediate intentional threat to themselves. And parents have said to me, but they are a threat to themselves, they're using drugs. But there's a line between I have an addiction and recreational use of drugs, and I actually took these drugs to try to kill myself right now. And so although I applaud the governor's and everyone's actions about this and bringing this attention, mandatory holds in the emergency department is not going to solve this problem. It's going to crowd our emergency departments, allowing us not to see the patients with chest pain, abdominal pain, orthopedic injuries. So there needs to be a larger picture on how to solve this problem.
Thank you very much. Our next presenter is Shirley Black, a registered nurse and a parent as well. Thank you for coming, Shirley.
Hi. Thanks. My name's Shirley. I consider Dartmouth one of my hometowns, meaning that I moved here and raised my family here, my 2 children, but I was born in Fall River. And I can tell you that my first child graduated from Dartmouth High in 2007, and I can't tell you how many friends/acquaintances that she knows that are addicts, which is completely shocking to me at that point, you know, going back. I always knew that there were some drugs going around, but not the opiates that were going around. By the time my youngest came to Dartmouth High School, and I'll be honest, I'll say it was at the middle school. There were opiates there. The kids were having parties. They were, you know, stealing from the medicine cabinets, you know, taking people's pills, not knowing what they were taking, dumping them in, you know, bowls, and just having a grand old time. And I think for some kids, it's a phase. I think for some other kids, I think some people's brains are wired differently. And I think that if you're one of those people and you really like that opiate feeling, there's no going back from that first time. It's insidious. It happens really quick. It's a very quick fall from taking pain medication, meaning oxys, to snorting heroin and then sliding and, you know, all of a sudden becoming an IV drug user. Nobody wants to hear that from their child. It's absolutely devastating. And it's the most scariest thing that you can ever deal with. I just can't even describe it, because I think there's such a stigma with this that you just can't discuss the elephant in the room, even though the elephant isn't going to go away. It's there. You don't know who to go to help. You know, you have a child that's out of control, not being the person that you raised, meaning any morals and values you instilled in that person, they're gone. They don't care. Nothing else matters except that high. And they'll do anything for it. And there's just no reasoning with it. So I am a big supporter of Narcan. I think, you know, there was just an article in the paper in South Coast talking about this butterfly effect, which I personally don't agree with. Narcan isn't just for addicts, it's for families. You know, these are our children. They have mothers and fathers and brothers and sisters that love them. And they deserve to get the help that they need. And, you know, they're not going to go looking for the Narcan. It's going to be the mom who's home worrying about their child going to sleep. And what am I going to do? You know, you're checking on them 10 times a night. Are they going to wake up? It's like having a child with an allergy to peanuts. If you're a responsible parent, you have an EpiPen. Well, if you have a loved one who has a problem with opiates, it's the responsible thing to have Narcan. And I just want to give you some information about, you know, the Narcan, since I do think it's some pushback on it. 40,000 people in the state of Massachusetts have been trained in Narcan. 6,000 people in Massachusetts have been saved by bystanders. That means me when I'm not a nurse. That means you if you're not a medical professional, not by a police officer, not by the fire department, by somebody who has, we'll say, no training in any medical or emergency medicine. And in the last 2 years, we've had 15,000 deaths in Massachusetts, probably some who could have been saved if people had Narcan. You know, it's $1 million epidemic that this country's facing, and I feel like it's mushrooming, and I feel like we haven't seen the worst of it yet. Because once these restrictions come into play with the prescriptions being limited, believe me, people are going to be jonesing for where am I going to get my pills, and they're not going to be able to get their pills, so they're going to go to the next best thing, the next cheapest thing, which is heroin. So 47,500 people in the country have died from overdose. That means 22 million Americans suffer from a substance abuse problem, and about 23 million people are living in recovery. So that means that every one of us, everyone in this room is touched by some form of addiction, whether it be alcohol, pills, heroin, your uncle who drinks too much at a party, who nobody's talking about because they have an alcohol problem, but, you know, we're my age, which I won't say my age, but myself and those older, you know, these are the little secrets we keep in our closet that nobody wants to talk about. And I think that the only way to combat this issue is to step out of the closet. We need to come out of the shadows. As hot as it is, as embarrassing as it is, we need to stand up and say, I got a problem here. But it's a really scary thing to do, you know, because what do we all do? I'm a nurse. I've been a nurse for over 20 years in South Coast, 10 years at Charlton, more than 10 years at St. Luke's. We get burnt out just like the cops do. And I think we need to hold each other accountable for the ugly terms that we use in regard to people. You know, addicts, losers, scumbags, all those people have somebody who loves them. You know, I'm going to say this, and I hope it doesn't offend anyone, but, you know, when the country made a movement in regard to mentally challenged people, not calling these people retards, you know what? When somebody did call them a retard, somebody next to you said, you know what? That's not appropriate. That's not how we address someone. And I think that we need to hold our coworkers responsible for that as well, because it's a nasty thing. So in regard to the 23 million people, you know, living in recovery, we all do know somebody. So it's not those people, it's all of us. As far as teens go, 1 in 5 high school students uses a prescription drug without a prescription. On average, 2,500 teens use prescription drugs to get high for the first time. 60% of those teens use prescription pain relievers. I mean, who used prescription pain relievers did so before the age of 15. So again, like Dr. Pope said, you need to lock up your meds. You can't leave them hanging around. I know Dartmouth Police has a drop-off where you can, if you're not using your prescriptions and you're done, throw them away. You know, don't keep them around, because kids will be kids and they're going to experiment. It's a lot of pressure. Prescription drug deaths by youth has surpassed suicide, death by firearms, school violence, and car accidents. And for the first time, driving under the influence of drugs has surpassed drunk driving. I think denial is as deadly as the disease, and I think the only way to fight the stigma is to stand up and speak out about it. The only way, really, I think, to combat this is through awareness and education. And I'm a big advocate for education. I think the communities need to do more. While I've been dealing with this, one of my biggest frustrations here in South Coast has been the lack of community events. And I'm sorry if that offends anyone, but I think social media has a great power. Facebook has a great power. I think that we have tons and tons of communities forming these grassroots groups who are having meetings, offering education, offering Narcan training. We have communities that do it once a month. It's insane the amount of people in Massachusetts who are stepping up to the plate. You have those in recovery who are speaking to kids, helping out. You have helping hands, who are on the front line trying to get these people off the streets because basically, when push comes to shove and it gets really bad enough, they end up homeless because it is extremely devastating to the family, and you can only put up with so much. I mean, these people are sick. They act sick. It's not the same person that they used to be. And I think really the three most dangerous words any parent can use is not my kid, because I was one of those people who said not my kid. I nearly fell off my seat. I just could not believe it. And I guess that's pretty much it, because I think we all kind of touched on the same things. And let me think if I want to say anything else. I don't think there's any easy answer to it. I don't think there's one solution to it. I think it's multifaceted. I do think the community needs to step up to the plate, and if where you live isn't holding or doing what you think needs to be done, then I think you start your own group and you hold your own, educational awareness event. There's nothing wrong with that. Even if you help, if 5 people come and you help one person, that's one person's life that you could be changing. It's just as easy as that. And that's it. Thanks.
Thank you very much. Our next speaker tonight is Connie Rocha Mimoso. She's the Director of Community Health Services at Seven Hills Behavioral Health. Thank you for coming.
Thank you. Good evening, everybody. Thank you for being here. Just a little bit about what I do in a nutshell. I've been doing prevention for the past 21 years. And while, people talk about addiction, we actually are out there 6-7 days a week doing outreach. So when Shirley talk about they end up homeless, that's who we reach out. We are doing outreach at 5 in the morning on crack houses, rest areas, hotels, anywhere from Wareham all the way to Attleboro. And we're really engaging with clients, with these individuals that we talk about our sons, our daughters, our brothers, our sisters at their level. Somebody said that, they're not ready, I think Dr. Pope said that, they're not going to be able to do a program, and it's correct. Our outreach team is out there to meet where they're at. Addiction might not, and getting clean might not be their priority. Maybe their priority is finding a place to stay. Maybe their priority is, drinking a Coke or having food, having clothes. That's their priority, because we cannot address addiction if we're not addressing their immediate needs. When When I started 21 years ago, this addiction, it was mostly seen out on the streets. You know, you kind of like knew who the addict was. You know, we would go out there, reach out to people, and just let you know that I thought I was going to be able to save every single person that I saw on the streets. Because, you know, I could talk, you know, I could walk, I could just connect with people. And, you know, I soon realized that it wasn't about me anymore, it was about them. So 21 years ago, addiction was a little bit different. So we thought, you know, we basically said, you know, it's those people out on the street, on Acushnet Avenue, on Route 6 or Riverside. Today, you know, throughout the years, addiction has changed. It has hit every single one of us. It doesn't matter if you're a doctor, if you're a judge, if you're a celebrity, you've been hit by this addiction, okay? In 2007, we became a pilot program for the state on Narcan. So we've been doing a lot of education on Narcan alongside with everything else that we do. You know, getting people into detox, getting people into, you know, shelter, testing people for HIV, sexual transmitted disease, you know, getting them to sit with us and giving them, you know, a plate of food. But in 2007, we became one of the pilot programs for the state. And, you know, today, people think that Narcan just showed up just the last few years, but it hasn't. You heard what Shirley talked about, how many people have been saved in the state of Massachusetts with Narcan that has been administered to individuals from a loved one, from somebody like me, maybe somebody like April, a bystander, a loved one. So we have been able to save 6,000 people with a Narcan. It is a tool, okay? It's not a solution. It is a tool for us to begin to engage in conversation with people. It is a tool that saves somebody's life. Maybe it is that time that, you know, there's an opportunity that that person will make a choice to go and, you know, seek some kind of program. You know, Kylie said that you know, it took her brother a year, you know, to get going on his recovery. I have individuals that I work with for the past 17 years, 20 years, but every day they are clean, and every day that they live is a success. I want to talk a little bit about, you know, stigma. You know, part of removing stigma among ourselves is really engaging in conversation about addiction, okay? A lot of our youth don't have that openness, that communication with a family to talk about it, because we as adults are not open to that. Stigma, you know, stops individuals from seeking treatment, from getting educated, from talking about it at dinner table. It should be a conversation that we could engage, just like we talk to our youth about, you know, don't go to the liquor store, or, you know, don't walk on the wrong side of the street. We talk to our youth about everything else except how to protect themselves from using an opiates or any other substance. So I've been blessed that, you know, I have a team of 27 people that do most of the work out on the streets. And we have had great result. Any day that I'm in the office and somebody says we didn't have a fatal overdose is a great day for me, okay? So any day somebody says Jane F. decided to go, you know, into the methadone clinic is a great day for me, okay? It is not a great day when we get a phone call at 2 or 3 o'clock in the morning that somebody overdosed, or we can't find a place for them to go into treatment, or they basically were left to die in a bathtub, okay? Or they were dropped at St. Luke's and, on the street, and now they're brain dead. Okay? So those are the bad days, and we have been having a lot of bad days in our area. So anything that we can do as a community, working together to raise awareness, even if it's an event once a month, whatever you want to do, house party, where you bring your friends and you talk to them about the risks of overdose and where are opiates. Begin to have those conversations in your community, because without that, we're going to continue to raise the stigma on opiate use or substance use. Thank you.
Thank you, Connie. I wonder, you mentioned at the beginning of your presentation about meeting people where they're at and assessing their situation. How can that translate into the home? How can we meet people where they're at, assess where they're at, and start to formulate some sort of a recuperating plan for them?
So meeting where they're at is really, asking individuals, what are your needs? What can I do for you today? We might think that we know exactly, exactly what they need, but it might not be their priority. So a home is really asking them, what's going on? How can I be supportive of you? Is there something going on in school? All of that, just begin to have those conversations, and do not criticize, or do not, begin to talk about, so-and-so has the son who's an addict. I can't believe that. How can, nobody helping them? It's really just helping that open communication, and, having that opportunity to ask your child, your youth, what can I do for you if you're struggling with anything? Is there anything I can help you with? And continue that conversation.
All right, thank you very much. Next, we have April Cabrera. She's the program manager for the Bristol County District Attorney's Office. Thank you, April.
Thank you. Thank you for having me. Thank you. So helpful. So the District Attorney's Office does play a very important role in the community. We actually have a community affairs unit, which I am a part of. And our community affairs unit focuses on several different areas, from bullying and suicide, elder abuse, and financial fraud with elders as well, to domestic violence. We also do a number of sports clinics throughout Bristol County, and we do host a really big Family Fun Day here in Dartmouth in the early fall. So we definitely try to engage the community in as many ways as we possibly can. The District Attorney, Tom Quinn, is very passionate about the opiate crisis and has made it a big priority in his administration. So we're doing a number of different things to try and address the issue in the community, supporting numerous community coalitions and community organizations who are working on these efforts throughout Bristol County, all the way from Attleboro down to, here Dartmouth and Westport and New Bedford as well, and Fall River. So some of the things that we've been working on over the past few months is working directly with the police departments, especially those who do not have drop boxes. We have made some headway with making sure that pretty much every city and town in Bristol County will have a drop box in their police station if they don't have them already. So we just assisted with letting them know how to get them through CVS or through other resources, as well as how to fill out the paperwork to make sure that they are officially legal to be in their lobbies. Some people didn't know there was paperwork involved. So we helped out with that kind of thing. In addition, we're also working on several different initiatives. Like, we know that this has to be approached in many different ways. So we're trying to do all that we can to support the other ways that can possibly help. So we are also going to be co-sponsoring a scope of pain training in in Norton, but it's going to be specifically targeting the doctors in the area, in the Taunton, Norton-ish area, on better prescribing practices, basically. So that'll be coming up at the end of this month. In addition, as Connie was speaking, I sat and thought about how long I've been doing prevention work, and strangely enough, I've been doing prevention work as of this year for 20 years. And as useful as I may look, I actually started this work as a teenager in high school. So as a peer leader, I started doing prevention work then, and it was more focused on a lot of tobacco and alcohol and marijuana, but you know, prescription drugs wasn't as big back in my day. But I have been doing this work for a while. And so because I believe, and a lot of people know, that a peer-to-peer model actually works, we're planning to host a Train the Trainer. So we're going to have a Train the Trainer for adults who work with youth in Bristol County, for them to then go out and train young people to engage their peers in how to talk about opiate addiction and prevention and getting them the help that they need. Because oftentimes young people are more likely to listen to their peers than they are to listen to us. So we're trying to, again, target as many different approaches as we possibly can. In addition, we're going to be planning several school presentations, whether to parent groups or to assemblies of students, middle school and high school, just, again, creating more awareness around the issue and how this can possibly affect them, bringing some real life stories to them so that they can really see that this can affect you in many different ways, and getting them the education they need, as well as providing them with tools and resources. There's multiple resources out there that already exists, and we're going to make sure that they get in the hands of the young people, as well as give students and parents some tips and some pointers on how they can better ask questions of their doctors, and making sure that they're being advocates for themselves, because that's the most important thing. A lot of people get sucked into becoming an addict through the prescription drug perspective because they hadn't asked those kinds of questions, and it may save a life if they knew the right kind of questions to ask. In addition, we do a lot of different resource tables and events like these, or just, you know, community resource fairs. We're always available to do stuff like that. We also have a what started out to be an underage drinking prevention task force, which consists of a lot of law enforcement from across the county, as well as community representatives. And basically the purpose of this task force was to make sure that we had kind of a unified front throughout Bristol County to address the issue of underage drinking. Well, since the beginning of 2016, we've decided that we also want to focus on the opiate crisis as well, specifically around teens and what's going on with them, because we are seeing that the numbers are getting a little lower and a little lower. So clearly there needs to be more education, more awareness happening among our young people to be able to hopefully save their lives and get them to not even start at all. So we will, the task force will be hosting their annual press event. It's going to be on April 26th at Battleship Cove in Fall River. And basically this press event is to raise awareness around safe practices around prom and graduation season. So this year we're definitely going to talk about underage drinking, but definitely drug driving is another issue that could possibly come up. So we're just going to make sure that we get the word out. We're doing as many things as we possibly can to support the community in any way, shape, or form that we possibly can. And as I said, the DA is very passionate about it, and making sure that we are not only, you know, focusing on prosecuting those who need to be prosecuted, but also that we're working on the preventative side of things as well.
Thank you very much, April. Next, we have Detective Kyle Costa of the Dartmouth Police Department. He's also the Vice Chair of COPE. Thank you so much, Kyle, for helping to organize this.
Thanks, Taylor. I really appreciate everybody who showed up tonight, as far as the participants on the panel, yourself, my colleagues, and everybody sitting in the audience. I've got 26 years on this job as of March 1st, and much like April, I know I look a lot younger than I am probably, but. And yes, I'm the guy behind the Facebook page, but all I ask is that we wait until the end. If you're going to cast flowers or you're going to cast stones at me, we'll do it after. First off, I'd just like to just see the show of hands again. Who is this affected directly? Panelists, and don't be afraid to raise your hands. Please raise them high. I just want to say I apologize, and I'm sure some of my colleagues would like to apologize, because we are some of those people, much like Shirley had said, that categorized addicts as scumbags. Every time we get dispatched to one of the motels on Route 6, okay, it's got to be a junkie. Get dispatched to one of the thousands of shoplifters we handle every year, it's got to be a junkie. you always put that stigma on them as cops, and I just like to start off by saying I apologize because I'm guilty of it. And the way that this epidemic is spread, much like the chief had said earlier, not only in Dartmouth but across the country, is it's just unbelievable, and it's affecting pretty much every community countrywide, and each police department deals with it in a different approach. Thankfully, with our Chief Zala, he's been real proactive about addressing this issue. And Chris, I can't say enough about his energy as far as getting a program together in the town of Dartmouth. It's not the town I grew up in. It certainly isn't. We're sandwiched between two major cities in New Bedford and Fall River, and a lot of times we're a catch basin for some of the things that you don't even see that goes on, or you don't hear what goes on, or you don't want to see that goes on. When I first started this job, marijuana was, a huge issue. Then everybody was labeling marijuana as a gateway drug to cocaine. Then cocaine became the biggest issue. The progression that we've seen with heroin, it's unbelievable. We just don't respond. We respond to, I can't tell you how many heroin-related or opiate-related incidents per year now, and it's the worst that I've ever seen. Much like Callie had talked about earlier, there has been a progression. We saw a spike in the amount of arrests or incidents involving Oxycontins, perks. And a huge initiative was put as far as, okay, let's go lock these people up for having prescription drugs that they don't have a script for. Then much like we've already talked about, with the other panelists, heroin came onto the scene, and it's bad. It's terrible. It's awful stuff that, again, you've seen it. I've seen a lot of hands that were raised out here. We see a lot more than you do. We see the people that have the needles broken off in their arms, much like the doctor spoke about. I can honestly say that the statistics, to me, are staggering, and we're just starting to really keep stats as far as overdoses, heroin-related overdoses. Now, even stats that we keep are skewed, because by the time we get to a call, per se, there's not going to be needles laying around, or somebody flushed the bag, or somebody just put somebody in a car and they took them to St. Luke's Hospital. Then it becomes New Bedford's problem. In 2014, we experienced 56 overdoses. 2015, 58. So far this year, 9. And I can tell you that those numbers probably aren't really accurate, that it's probably times 3, if you will. By the time we get, like I just mentioned, by the time we get to someplace, it's not, the things are gone that we can look for that really indicate whether or not it was an overdose. One of those, and what really changed me, to be quite honest with you, and one of the sergeants sitting in the audience today went to an overdose, and I'm not going to bore people with war stories. That's not what we're here for. That I got dispatched on a Sunday morning with another detective, because we go out to any type of suicide or overdoses. And we went to one of the motels, which I'm not going to mention the name. And when I turned the corner to go into the bathroom where the deceased person was, and Dr. Gifford, you already know where I'm going with this, that I found a 7.5 month woman who had a 7.5-month-old baby inside of her, who had hung herself. She was addicted to heroin. She had no way out. The heroin led to different mental health issues that she had, and I turned the corner and I wanted to throw up, to be quite honest with you. I've gone to car accidents where people are dismembered, other unmentionable calls where people have committed suicide that isn't too pretty. And that was the worst thing I ever had to go to be quite honest with you. I'm a father of 4 daughters, so that really hit home with me. It does hit us, and it hits us hard. And a lot of people don't think of that. That, a lot of times, and again, my colleagues in the audience will say it, that there's a lot of fingers that are pointed at cops for a lot of wrong reasons. That, what are you going to do? What are you guys doing about it? This isn't a me problem, meaning the police department. This is a we problem. And we all have to get together and get on the same page as far as what we're going to do and how we're going to address this issue. Much like it was mentioned by April, we have a drug drop box. The chief was wonderful. I approached him at the end of last year and I said, what are we going to do about this? We were able to get a drug drop box through a grant through CVS. And I'm happy to say we did fill our paperwork out appropriately, April. We're good. Within the first week, the drug box was overflowing. When myself and Detective Frank Oliveira went through it, you can't imagine the amount we came up with as far as opiates or opioid-based narcotics. It was staggering to us just to even look at these things going, wow, these are in people's houses. And I can tell you that when you're thinking of the opiate or the heroin problem as whatever you want to address it as, that's a gateway also to probably 3/4 of the other calls we go on, as far as domestic disturbances, breaks into houses, cars. It's all connected, and we're trying to get a grip of it best we can. And I can tell you right now, we don't have a grip on it. And it's because it's a community effort, and we have to get out of that me mentality and get back into the we mentality. Connie had asked at the first meeting we had, what could she do to help us, the police department? When you automatically think of, probably resources, if you will, how to get a drug drop box, how to get more Narcan. And my answer was simple to her, and it was to educate us. Educate the police. We go through an academy. We learn how to drive a car. We learn how to shoot a gun. We learn how to handle domestic disturbances. The one thing that we really don't know how to address is addiction. We're not psychologists, but we have to play them on a daily basis. So to educate us, it's just as important as educating everybody else who's sitting in this room. It does not discriminate. I can tell you that right now. I know I've mentioned the motels. Yes, we go there, I can't, dozens of times, in a week, just to deal with different issues. Guess what? The motels are no different than Paynerum Village. We've gone to plenty of calls in the south end of town where these people have million-dollar homes. It does not discriminate. It starts much off, like the doctor referred to as, okay, I had rotator cuff surgery and I was prescribed Perks. Okay, my shoulder feels better, but those Perks felt pretty good too. And guess where they end up? Trying to get a script from a doctor saying, I'm not feeling that good anymore, doc. My shoulder hurts. Maybe the doctor will prescribe them. And I'm hoping that for the most part they won't. If they're not prescribed, guess where they end up? Looking to buy a bag of heroin on one of the street corners in New Bedford or Fall River. And again, I hate to really label New Bedford and Fall River, but it's true. That's where you're gonna come across it. It's not the only place you're gonna come across it. We have 3 narcotics detectives that stay very, very busy, and I can tell you that right now. And guess what? It doesn't happen in my town mentality that a lot of us have. Lose it. Because I can tell you those guys are flat out busy taking this junk off the street. And I wanted to use another word, but I see children in the audience. Because it's exactly what it is, and it's killing people on a daily basis. The only thing that I can really say to end this whole thing as far as the police department is concerned is, together we can. There's no way that we're going to get a grip of this alone. It's going to be up to everybody in this audience to pick up the phone. I met Shirley through Facebook when she started sending me some articles, and then she shared her story with me, and then that led to a meeting with Chris and the other panelists, and they said, is there anybody else that we can think to bring up here? And she immediately came to mind. She's a parent. She's gone through addiction with one of her children. She's a nurse. She sees it on a daily basis. Well, guess who else sees it on a daily basis? Every single one of you. And to bury your head in the sand, it's not going to be the answer. Or to, lay flowers on the side of a road for everybody who died of an overdose in your town. It's a great effort. It really is. But guess what? I truthfully think, and this is my own personal feeling, and I don't speak for anybody else, it's time that we get a grip of this thing and we beat the hell out of it. I really want to thank everybody for coming, and it's really inspirational to see that we had this much of a turnout. Thank you.
Thank you, Detective. You mentioned that your attitude changed when you first came across that incident, not for the first time, but it really hit home with you. How has the police response changed? Has that attitude change evolved into a response change from law enforcement?
Hard question to answer, Taylor, because there's 65 of us in a department, and to me it's based on an individual case by case on how particular people feel. I can say that the guys that I'm close with in my office, I can see an attitude change, but again, it's going to be on a case by case basis as far as each officer is concerned. And I think the only way that that's going to come is through more education and just addressing this issue.
All right, thank you again. And last but certainly not least, Matthew Vangel. He's with Christian Belief Ministries. Matthew, thank you for coming tonight.
Thank you very much. Currently, I'm a third-year seminary student in pastoral studies, and at 57 years old, I'll break the age rule right now. I never thought God would use me at this older age to do these kinds of things. I can only speak from the Christian point of view tonight. But God has originally led me to share the gospel and find resources for poor inner city churches in our area. These are churches that can't even afford to put the heat on, and we want to help them with resources originally to minister in their neighborhoods. So I started this nonprofit ministry working in Fall River, New Bedford, and as I did with these congregations of 10 and 40 people, I started to meet families, people I'd never met in my life that are being torn apart by all types of issues, especially when it came to them being families of addiction. Yeah, I talked to a 45-year-old woman who had lost all 3 of her children to drugs, and she herself was a drug addict, and she's still going to meetings every single night, and she witnesses to people and talks to them, trying to help them through the healing process. I talked to another mother who has a basement, and the only thing in her basement is a couch. And every day, she's in the fetal position on the couch, with a blanket over her head, with her cell phone on, watching Facebook to see if her child in the city walking the streets updates their Facebook page. And that's their whole life. You know, parents are now agreeing now to help only their family member if they agree to go for recovery. They've learned how to watch out for some manipulation that goes on. It's very sad that trust is the first thing that breaks and the hardest thing to bring back in the families. So addiction takes the entire family as prisoners. No one's spared at all. Brothers against brothers, husband against wife, siblings against siblings. It's a terrible toll that's taken on it. And many of the resources the families have taken, they're used or depleted by this addiction. You know, some of the resources God's provided that we can try to help are clothing, food, recovery Bibles for the families, because there are a lot of faith-based 12-step programs out in many churches in the area here to send people to. Also try to find faith-based resources out in the area, such as Teen Challenge, which is out in Brockton for men, Teen Challenge for women and young children in Providence, and in New Bedford we have Breaking the Chains, which these are just long-term programs that have a high success rate because they put the addict away in an environment of healing for 12 to 15 months. And with an 85% success rate in some of these programs, it's an issue we're trying to help out and help try to fund. And finally, we have prayer with the families for encouragement. We get together, we pray with people, we end up crying with people in their living rooms. We end up just trying to show that love and compassion and sharing the gospel message and the faith we have in Christ and in Christianity. So I'm here tonight just to share with you what I hear from family sessions every single week, what I hear from mothers and fathers and brothers and sisters and boyfriends and girlfriends and single moms that are trying to hold on to their kids from child services who also are addicts in the city, and how God has brought them back hope and healing to the families of addiction and the addict. Because everyone is valuable, and we're taught never to give up on anyone in seminary that Jesus hasn't given up on. Thank you very much.
All right. I'd like to thank everybody for coming out tonight. You're doing your part. We are going to continue to have more meetings and more discussion and a lot more progress, so we hope and pray as we continue to talk about this issue. I believe you've all received one of the programs for tonight. There is contact information for both Chris and Kyle at the bottom if you'd like to get in touch with them if you have any further questions or comments about this issue. Thank you so much. Have a great night.